Hi, my name is Eva Steiner and this is my project Psychotherapists Around the Globe. I am interviewing the psychotherapists around the world and asking them the same 8 questions. I am wondering how mental health profession is in their country. Today we are going to... Thank you for doing this interview with me. Before we start, can you tell me a little bit about yourself?
Well, hi, I'm Eva Kostyrovka. I'm a psychologist and psychotherapist. I'm Polish, and today I was invited to represent France, where I have relocated 4.5 years ago. But as we discussed, I might as well represent comparisons with UK or Poland. And thank you so much for having me. I'm thrilled to be part of the project.
So tell me a little bit about French culture. What is some holiday or tradition that the country celebrates? And if the culture would be an emotion, what emotion would it be?
That's a very interesting question. So just to give a background, I'm Polish and I was born and raised in Poland, so I think that's my main point of reference. And then I have relocated to the UK where I lived for 8 years. So I have been in Paris in France for the past 4.5 years. And I suppose, like some other countries which have been represented in interviews, it's a European country, so perhaps shares lots of similarities. It's a culture with a heritage of Greco-Roman culture, Latin culture, definitely Mediterranean culture, so quite close to Spain and Italy in some ways. And Catholic has been the main religion in France for quite a long time. It's a laic country now, but at the same time, we see strong influences, I think, of that religion. So I think like in some other European countries, the kind of celebrations linked to Catholic religion or Christianity are the most important. Obviously, Christmas is a very big one. I was thinking about a particular French holiday, and I think that's 14th of July at La Bastille. So that's a moment which symbolizes the birth of French Republic and the moment when a French Revolution takes to the streets and successfully takes the prison in the city. And it's important to keep it. It was not necessary to liberate the prisoners, but just to arm people. So it's a symbol of uprising against the royal oppression and against the king. And that's a very big cornerstone, I think, of French culture. I think French Revolution is very interesting, can be seen as something a little bit more ambivalent in other countries. And even though French people can acknowledge perhaps what the terror led, it is something sacred. And I perhaps did not realize that before moving there. This is a really cornerstone of the Republic and what French values are represented. And I suppose it's a celebration where people might meet for a meal or a lunch or dinner and get together. The very beautiful fireworks, very famous in front of the Eiffel Tower. Interestingly enough, they wouldn't have fireworks for New Year. This is like a very big celebration.
Well, interesting that they don't have fireworks for New Year, but
yes,
for this
they'll be
celebration
much
they do.
smaller. Yes, this is a day where, yes, I was surprised when I firstly moved because, I've been questioning where one can see them, and actually they're not very big deal. But those are the most famous ones. As for the emotion, it's quite an interesting question for me because my first thought was, well, I thought about proud and angry, and then I thought, oh god, that's negative thing, and I cannot say that in interview. And then I have spoken with a few people, and it's perhaps about the perspective. I thought it's definitely something which I have picked up because it's really important where you're coming from when you move, and I have moved from the UK, so it's an emotion which is definitely very frowned upon. In the UK, it's absolutely not acceptable to express anger. And you need to go to great lengths not to show it, and show it in a very subtle way, and show that you can control it. And it's incredibly important. So I think that made me quite sensitive. It was quite a surprise to see how French people don't have such a negative attitude towards this energy, towards this emotion. Perhaps kind of similar to Latin countries in some ways, that it is socially acceptable to get a little bit annoyed, to complain, to be unhappy about something. And definitely I think there's less blockage to express this, where I was thinking like in perhaps psychotherapy work in the UK, can be quite a lot of work like digging it and understanding it and trying the patient to realize and take ownership of it. Here I think it's less of the case, it's very present. And 2 anecdotes which I often tell people is the first, when you're driving in Paris in France, it's very common that people might, bring the windshield down and shout and scream, or I have even seen people fighting on street. It's not that everybody does it, but obviously from the perhaps in comparison to the UK driving or even the Polish driving, where honking is not something which one does do and it's an exceptional condition, movements. Here we sing very kind of agitated and a very expressive way of driving. And a second anecdote, which I often give, is when I was relocating here, I was preparing for my French exam. And the examples of writing that one needed to practice, they were complaint letters. They were complaint letters to town hall. They were complaints letters to the newspaper. Interestingly enough, whereas if we're thinking about English exams, it often would be like an essay where one weights cons and pros, etc., and tries to give perhaps a reflective statement on something. I think it's something in French culture. It's fine to be argumentative. It's fine to express one's opinion. It's fine to be opinionated.
Yeah, and the emotion of pride.
Yes, I think French people are quite proud of their culture and heritage. And obviously, France had a great influence, as we know, historically, politically, intellectually. And I think people can take a little bit more easily offense here. Yeah, that's my experience, which is perhaps a bit different. But again, it's about me coming from the UK and seeing the difference, that perhaps it's something which, again, British people wouldn't quite show. Polish people might be more cautious about, again, because I think, it's a different culture, Slavic culture. And here, I think it's something which we can definitely see quite a lot, that people can be quite proud and can show when they found something offensive in their gesture or in their mimics or expression. We can feel that emotionally.
How did you become a psychotherapist, and what is your therapeutic approach?
I've originally trained as psychologist in Poland, so there's a very classical training, 5-year-long master program, some placements. And then I have relocated to UK, where I have trained as psychotherapist. And I have trained in 3 approaches. So I have trained in psychodynamic psychotherapy, which is perhaps an approach coming from more classical psychoanalytic therapy, but still quite active. And that was very lengthy training. So during that, I was able to work, and most people are. But at the same time, we need to spend 1 day to train, plus quite a lot of free time for other commitments. And it's a training that would require you to be in a personal therapy a few times a week for 4 years. It's a training during which we have a mix of seminars, individual supervision, and we submitting very closely supervised notes. So verbatims of sessions. So basically transcriptions of the sessions. So very insightful course and very rich in some ways. And I have completed infant observation, which is something which I don't think so many other countries do. And it was incredibly interesting. It was a very rich experience for me, because we observe a baby with a mother from really first week of the baby till first birthday. It's such an intimate insight into how the relationships develop and what is the beginning of the relationship. So absolutely fascinating. And it's one of the best things I think I've done in my training. It's something, because it's quite unusual, I suppose. That would be, I suppose, psychodynamic training. Then I have trained as cognitive behavioral therapist, and the training in the UK is often funded and supported by the government. There is great push towards training CBT therapists. So I have been offered a funded place. So I have been paid to train, and my course has been paid as well at the same time. And there was quite an intensive 1-year-long training, during which I had a placement 3 times a week in a psychotherapy center, and have been seeing lots of training cases, and had 2 days at university with a lot of teaching, and then individual supervision and groups where we practice skills. And then the final training, which I have completed, was interpersonal psychotherapy. I don't think so quite popular in Europe. It's something which was drawn from US, but it's a really interesting approach for working perhaps on interpersonal skills in kind of more short-term basis, and working on relationship patterns, interpersonal communication. But it is a training which is run by Anna Freud Center in London, and you need to be psychotherapist in order to train. So not everybody can do that. And now, when I relocated to France, I have firstly validated my diploma. So as a foreigner, you need to validate your diploma and register firstly as psychologist. So in order to become a psychotherapist in France, you need to either be psychiatrist or psychologist. So it's quite formalized and standardized in some ways. I think Poland can be slightly similar, but I'm not sure whether it's like a legal requirement. Whereas here it seems quite set in that way. Very different from UK, when you can come from different background and perhaps catch up with placement and some other intermediate courses. Here, the idea is that in order to register as psychotherapist, you will need to have psychology, psychiatry. And I'm sure it's possible perhaps to bypass that, but perhaps my impression much more difficult. And a psychology degree would be 3 years of license plus 2-year long master degree. So that's required to be psychologist. So I have firstly validated my psychology degree with the Ministry of Education. And following this, I have registered as psychotherapist. And here, in order to register as psychotherapist, apart from this basic kind of medical psychology training, one is required to complete a psychotherapy school, but they are government-approved psychotherapy schools, which will have their own requirements. And then I think it's required to have 500 of clinical hours, but specific trainings might have lots of different specific requirements. So I felt like I was quite lucky to be able to register here as psychotherapist, but it's quite standardized. I think psychotherapy law has came not that long time ago. So I think the psychology registration was more established, and I think there was some attempt to formalize psychotherapy. Therefore, you cannot use the title unless you have a government allocated number to be psychologist or psychotherapist. You cannot use that, and you cannot advertise. But interestingly enough, psychoanalyst is not a protected title. So something which again is seen in other countries, like something which can take a long time and is very thorough to train. A lot of people might call themselves psychoanalysts. And another interesting, I think, observation is perhaps psychodynamic psychotherapy, which is so popular in other European countries and can be like, well, I suppose something much more popular than classical psychoanalysis. It's perhaps less popular here. So psychologists might have done some training, some groups, etc. But I was not able, for instance, to validate my psychodynamic training here because I kept registration because there's nobody that validates that really. Either people are becoming psychoanalysts or they taking a bit of interest in it and training a bit, but more informally. Whereas in Poland, it's a big wave. We know in Austria, it's a big wave of psychotherapists. In the UK, very popular avenue to take to become psychotherapists.
How society looks upon psychotherapy or any psychological help?
I've been thinking about it a lot, and I think it's something, I mean, I firstly start from maybe like political, systemic view of it, and then maybe go into more interpersonal one, because I think there's two sides to it in some ways. So firstly, to begin with, I think it's systematically overlooked, and it's quite a surprise because France has an excellent health service that French people are quite proud of, and I think it's one of the best in the world, we could say, in terms of how easily it's accessible, to what extent we can see a specialist, and how short is a waiting list. So I think psychological help is really in contrast to that, which is quite a surprise because I think my experience of being in the UK was that I've been hearing a lot about the cuts and how government is cutting a very good provision of psychotherapy, etc. So I was thinking about austerity, and then surprisingly, when I moved here, I realized that the provision here is much smaller than even in Poland. So it's very difficult to see a psychologist, psychotherapist, if we're thinking about primary care. There are things accessible to people who might need secondary care level. So they might have schizophrenia, they might have very serious bipolar disorder, they might have a very clinically severe depression. But on the kind of more primary care level, for individuals who might be kind of high functioning or struggling getting along, it's much harder to see someone. And government has made an attempt to make it more accessible. A few years ago, there was a law that passed that one can see psychologists and it will be reimbursed by the government, but just one needs a prescription from general practitioner. However, the law has been greatly opposed by psychologists, by the lobbies and syndicates of psychologists and registering bodies of them. As government has allowed for sessions to last only 30 minutes, and psychologist is not allowed to expand over that, and has allowed a very low fee for 30 minutes again that can't be expanded. So basically, it's something which is not in standard of the care. Well, I think like probably everywhere around the world, psychotherapy sessions can last between 45-50 minutes. They're much longer, and the clinician might block an hour in their diary to do that, to do notes and have a bit of time between. So again, very much in contrast with the standard of the profession. I think that's what was very closely opposed. And then the fee was very uninteresting. So even though the law has passed, I had lots of people approaching me whether it's possible to arrange that with me. It's impossible to find a practitioner. I don't know anyone who practices experience that in practice. So that's quite disappointing, we could say, because there was some recognition, I think, after COVID and pandemic to try to make it more available to people, widely available, but not successful in that way. I think we think also less of kind of employment support. Again, my point of reference is UK, where there's such a huge, interest in making mental health accessible at work and in providing workshops on mindfulness, on stress management, on anxiety, on work-life balance. Something less prominent here in companies. And I definitely hear a little bit more about how companies struggle to deal with someone's burnout, with stress-related issues at work, and how companies might really not have the right tools to manage that. Third wave of mental health, we would say, hasn't quite arrived here. At the same time, it's interesting because France is a culture where psychoanalysis has taken great roots. If we're thinking about the post-Freudian times, and they had a very prominent, famous psychoanalysts, thinkers, philosophers. So I think that influences the culture. So interestingly enough, my experience is French people have a way to talk about it, that there might be certain level of introspection, understanding, they wish to understand themselves through a relationship, have the vocabulary for that. So it's definitely not a country where I think thinking about inner self, our relationship is a taboo. People are able to do that, are able to reflect. They're not, my experience again is not that people are not somatizing. So it's an interesting contrast, I suppose. But in some ways, for me as a practitioner, of course, it's quite disappointing.
What is the society teaching about child-parent relationship, and whether this value of society also influence how you design your interventions as a therapist?
So here I have quite a lot to say about that. I think it's probably a subject I feel quite passionate about. So maybe again, I start to think about more systemic kind of place of that, and then go more towards consulting room. So to begin with, children are very important in the culture. It's a country where families' values are quite important. So Southern Mediterranean in that way, I think. We can see definitely grandparents very involved with small kids, taking them to activities, picking up from school. Perhaps not like in Asian countries where it's really grandparents bringing up super actively children, but at the same time, very, very involved. And we can see children, I think, quite a lot in the public space. Of course, it can be improved, and I'm in absolute favor of that. But definitely, children are present in very good restaurants. They should perhaps behave, but they're taken to quite a lot of places and invited and included. One thing which I always find interesting and surprising, perhaps from a perspective of expat, is the amount of school holidays that children have it. So, especially for an expat. So once the children enter the kind of school system, since they're 3 years old, they're in preschool, they enter this very interesting school rhythm where the school breaks every 2 months for 2 weeks. So during a year, we're looking at 8 weeks of holidays, plus 2 months long holidays in the summer, plus no school on Wednesday, because the school rhythm is such that they're only 4 days. So interestingly enough, I think it shows us how children are in some ways valued, that their needs are more important than perhaps parent needs. But at the same time, I thought it's also a bit more, we could say, not conservative, but a bit more classical view that family needs to look after the child. And of course, there's a great provision of activities and camps that one, and even in child school, that one can sign up child for. But the idea is that child, often parents are trying to arrange something and to be with the child or send them to grandparents if they can. So this idea that child shouldn't be too compounded by the school, I think. But at the same time, interesting in terms of feminism, and because it's quite a feminist country, yet we think not that much of childcare at that point in comparison to other countries, perhaps. So that's the first aspect. I think another aspect I wanted to bring up is the role of the man in bringing of the child, which is a very forward-thinking country, and there are big movements around the world to encourage perhaps men in Western cultures and other cultures to get involved with children. And here I think it's very internalized. I see a lot of dads taking kids, being very warm with them, being very patient. So not a macho country. I don't have an experience when there is a kind of stereotype of a masculine. Some men are very keen to spend time with their children, be present. It seems a natural thing here. Now, there are two aspects which I wanted to talk about, which France is again quite famous for. One is maternity leave. So that's something which came as a surprise to me. that maternity leave lasts only 2.5 months here, and it's very, very common. There are some ways to extend it, but with very, very limited pay. And I have came across a lot of women going back to work at that mark. So that's very, very early, I think, for such a developed country with such a good welfare system. Again, quite surprising, that aspect of it, I think. And a man can have, I think it was, since I've came here, it was extended already to a month. Perhaps in comparison to UK, where there's such wish and an effort to meet Scandinavian countries, where the paternity-maternity leave can be shared. So I know quite a lot of people who might have to try to share the paternity-maternity leave, and that would as well, perhaps a bit later on when the baby's a bit bigger, take a part of their paternity leave and even stay 3-4 months at home with half pay if they can afford that. But in comparison to France, where it's very, very uncommon. Perhaps, again, this wave of change hasn't quite yet arrived here. I think it's wonderful if somebody wishes to come back to work when they're 2.5. I'm all for the choice and for doing what, one wishes to and what fits one's family and one's personality. But at the same time, I think it's really heartbreaking to see some of the women and parents who place the children in childcare and often in a nursery, creche, 2.5 months. So it's a tiny baby. And somehow France is not catching up, I think, with this idea that politically, that early attachment is so important. Interestingly enough, I suppose I compare a lot to the UK, but we see a 360-degree turn in the UK, where there was such a pressure on boarding school, independence of children, whereas UK will be very close to Nordic countries in that respect now. Thinking, it's a very important time, very important period, if we can encourage parents and make it possible for them as much as possible to be with child at this early age. So it's a great regret for me. I think there are some psychologists speaking up about it and trying perhaps to influence policy making, but definitely something surprising. I think it stems a lot from, I would call it a Thatcherian feminism. So it's a lot of, feminism, which was very positive, as we all knew, allowing a woman to go back, allowing a woman to perhaps have a career. And that's fantastic. And we know there's lots of progress still to be made in that area, so much more. But at the same time, I think it lacks this idea that it's still a very important time. And it's fine to have both if we can. It's great if people can be more with their children at the early age and then they can continue their career. And I think there's a bit less of that flexibility here. And early attachment, I think, is not as prioritized clearly. Because if we think about it on a deeper level, it tells us something about the society, that its independence is seen as something positive, that the baby should separate and socialize and have friends, etc., from a very tiny age. So I think that's on that level. And then I have another comment, I think, about French discipline, which is famous. And I had lots of people approaching me and asking about that. Some people might have been reading articles about parents leaving their children to cry out and encouraged to do that. So I think to comment on that, I think it's something which I have definitely experienced here in comparison to UK, in comparison to Poland, where I think positive discipline, early attachment is so important, and perhaps meeting early babies' needs and small child needs is seen as something crucial, and lots of people are working on that to make a social change. Perhaps a little bit less of that here. At the same time, it's a spectrum. So in France, I think people can behave in lots of different ways, and lots of people are perhaps following those ideas of, being very close and intimate with their children in the early age and close emotionally and very responsive. And at the same time, really lots of parents interested in positive discipline. So I know some schools even offer those kind of workshops. So there is some kind of change, which we're seeing. But at the same time, I think there is a lot of backlash. And I think what I've saw in France, there are also quite famous, prominent psychologist figures speaking up about how positive discipline is dangerous. And they're coming from a point of view, I don't want to completely undermine that. They're coming from the point of view that perhaps it's very important to have boundaries. It's very important to set limits. And of course it is, but I think it's sometimes, I don't think so enough of social change have happened to make that clear. I'm thinking about the question, how does it influence the therapist relationship? How does it influence the work? It's hard to answer that question because, of course, I've trained in the UK, I'm Polish, I'm a psychodynamic psychotherapist, so obviously I'm all in favor of nonviolent communication, positive discipline, and I take great interest in those movements and those techniques. So that's something which I might be working with in my practice. I think here my experience is that psychologists would be, that's what I've heard from other people, that might be encouraging to set the limits. And that's of course helpful, but I think it's still very important that the idea of authority, setting the limit, and the child listens and follows. And I think in a psychotherapy practice, perhaps some practitioners working with families might be working on that. Perhaps slightly different from the UK, where I think it's even in choices of words I've had from not psychologists, but perhaps professionals who work with children, like teachers or other professionals, using the word caprice, which is like do something on a whim. So it's something which perhaps I would have had less in the UK, perhaps less in Poland. It's perhaps the effort now is trying to understand what is behind the child's behavior, what the need they're expressing, and how to manage that. Whereas here, I think there's quite a lot of traditional ideas behind it. And even though it's changing and it's definitely, there are great movements towards positive discipline, I think there's something of that.
What are the learned beliefs regarding client-therapist relationship, and can the relationship continue outside the therapy once the therapy process is over?
So in some ways, I haven't seen that many differences between UK and Poland over here. It's a European country, what I wanted to stress. So my sense is it's not a stigmatized relationship, and people might have an idea what psychologist does do and psychotherapist does. From media, there's quite a lot of psychologists, psychotherapists invited to different programs, podcasts, to write articles. So there is a great exposure to that. So I think it influences the culture. And let's remember that French people have been heavily influenced by the philosophers and psychoanalysts in the beginning of the century. In some ways, lots of people might have an idea what does it represent, what does it mean to be in psychology, what it's like experience. But it's a spectrum, and I definitely have noticed that perhaps a little bit less often than in the UK, but kind of similar than in Poland, people might assume we are a figure of authority. And sometimes they might call me a doctor or ask for a prescription, or a little bit confused about that. And perhaps put quite a bit of pressure to have very quick solution or advice to solve something. But neither, I would say, it's extreme. And those patients can quite quickly adapt. So once they get the sense what is like the process, they can take to it and they can relax in it and understand it. So even in CBT, because CBT is perhaps a technique-focused therapy, it's still a therapy, one needs to remember. It's still a work with emotion. It's still a work on understanding vastly something before trying different techniques. So I think in all my clients' work, it's about the process and therapeutic relationship. And I think even those clients who might think that I'm an authority and I know the answers, they can relax to it. So I think I had quite positive experiences. Another thing which I wondered about, but I don't know if that's definitely not research-based, I wondered about attachment. So I wondered whether French clients would come to therapy with more in crisis, so more in a crisis point and wishing to resolve something. And interestingly enough, when I've exchanged with other people, lots of people might say, oh, I have seen psychologists or psychotherapists, and they would say, well, I've seen them for 2-3 consultations. So obviously that's slightly different perhaps from my experience of what like psychotherapists like experience in Poland or in the UK, where that's seen as an assessment or consultation. For me, that's very much, I call it a consultation, but for me, it's an assessment time. So to really understand and work out things. And then perhaps I'm a great favor of short-term work. And UK is really prominent doing that. And I mean, it's fantastic sometimes. Not everybody needs years in psychotherapy, and it's great if somebody wants to do that and that's what suits them, but short-term work can be super effective. But I think 2-3 consultation, that's kind of at the limit for me. So I've noticed something about that there's this idea that perhaps unconsciously one shouldn't be too dependent on psychologists. Then one should go, have advice and go home, as I would say, like symbolically, rather than perhaps really allow oneself to be in the process. Again, people can take to work and can discover very quickly what the work can give them, and they can see a value in it. I'm experiencing French patients staying in therapy and taking quite a lot out of it. But for me, it links maybe to this early attachment thing also, that somehow this idea one shouldn't be too dependent, one shouldn't get too attached. And perhaps unconsciously in the culture, it's hard to see beyond that.
And the second part of the question, can the relationship continue outside the therapy once the therapy process is over?
I think in the UK, for instance, I'm again comparing, this is my benchmark, that's a very big deal. And that's kind of seen as no professionally. And lots of registry or organizations be very strict about that. It's kind of really verging on ethics, and something which I think one would be very early taught. So I think my experience in the UK is that ethics is a very important part of the training and of registering process and of supervision, and it's very, very seriously taken on an administrative level, but also in a kind of really taking it in and understanding it and really making it your own, internalizing it. So it's quite a big deal in terms of training. And I think here, I haven't heard of anyone who does continue relationship. So like a registered psychologist, psychotherapist. But one needs to remember that lots of psychotherapists would be trained psychologists. So that it means that kind of perhaps the first training was quite boundary training, if you like. And I think it gives certain kind of structure to thinking, or kind of a professional, you could say, persona. And lots of, I think, psychotherapists will inhabit that then later because they have trained in that way. But definitely it's not very common. I don't know anyone who does it, like perhaps in some other cultures where the kind of boundaries are much more fluid. But I don't think so the registering bodies would be as strict about it, meaning whether, that's not my sense that it's such a big deal. I think I'm definitely noticing that when I pick up my patients in a way to grow, I'm obviously quite pleasant, hopefully, but seeing perhaps other psychologists having a bit more of chit chat. And I know it depends on the approach, but perhaps much more than in the UK, I wonder. But not overly personalized, but more general one. And so perhaps there is a little bit more flexibility in that way, tiny one. But again, I think in the UK, psychotherapy is quite formalized in some ways and quite established. Here, things perhaps are a little bit more fluid. But most of people I know wouldn't consider that as helpful and more as a really deviation from standards of the profession. So yeah, not a common thing.
Is supervision a must for a therapist?
No, the short answer is no. And definitely less, I think, than in Poland or in the UK. I would use the words less internalized. So it's something which, if one is a psychologist and decides to train here as a psychotherapist and registers with a specific body, that might be their requirement. And lots of psychologists that I have encountered would tell me about, they have trained as psychologists and they have done a training and they have been a part of this group, this supervision group for a few years, or this reading and practice group for a few years. So there are some interesting experiences one can hear about, and definitely helping people to master their skills and work on their therapeutic work. But perhaps it's less of the thing here, really. I think in terms of, in the UK, it's seen as a continuous thing. Yeah. So for instance, I still have kept my British supervisors, and they extremely experienced, and they have their own supervisors, because that's seen as something which helps your mental health, which helps your practice and your patients, so makes your work much more excellent. But also it's really important to have that space rather than be isolated in a private practice or in certain institutions. And it gives you a space to really reflect and think a bit more profoundly. So definitely something of huge value. And I think here less common in the sense that not everybody might have it throughout their career. I don't think so that experienced psychologists, from my experience, psychotherapists here would have one. I mean, perhaps registered with certain organization, following certain path. But I think a lot of clinical psychologists would practice psychotherapy. They experience they might not have that because they didn't see the need for it. And I think it touches on the need for continuous professional development. Again, UK has a quite high standards of it, registering organizations in Poland as well. And I'm hearing of my fellow psychologists, psychotherapists, both in the UK and France, continuously doing something, going for this conference, going for that training, reading this on. Whereas here, I think it's more ad hoc. It's not perhaps seen as something that one needs to do yearly or to that extent.
What are the most common complaints that a client comes to therapy for?
My experience is obviously very particular because I have an expat practice, and I have my practice in a few approaches. So it's, for me, it's such a myriad of difficulties people can bring, and such a spectrum, because obviously I'm psychodynamic psychotherapy. So I would see a lot of patients bringing interpersonal difficulties, childhood trauma, depressive struggles, low self-esteem, imposter syndrome. At the same time, as a CBT therapist, I would see quite a lot of very specific, perhaps, concerns, and people might seek me out because of that. So they might come with specific phobia, they might come with OCD, health anxiety, agoraphobia, panic disorder. That might be the case that psychiatrists might recommend seeing CBT therapists in such cases. So patients might come with very particular difficulty, and obviously there could be underlying things and things behind it we can look later, but there could be quite a lot of specific things, I think. And then, of course, a lot of general anxiety, stress at work. I think I'm seeing a spectrum. It's very hard for me to see whether there will be like the most common concern. I think what it tells, I suppose, about French culture and my expat work is that generally people have language or understanding of it. As I said, I think at the beginning, patients are not somatizing. So it's very rare that I would hear, oh, it's this or that. And, once you poke at things, you see that there's quite a lot to work with, and patients might have some kind of understanding or take on it. So, and then there's interpersonal aspect of my work, which I think I'm sure you've heard from other patients, where I would see people whose even English is not their first language, and they have been in intercultural environment, they have relocated, they have moved around, and there's lots of interesting work which I absolutely love and I'm very passionate about, where patients might, for instance, deal with forced marriage that is encouraged by the family, or with lack of acceptance of the choice of the partner because they're not coming from the culture or religion, or race and discrimination, which can be quite a prominent and very painful thing. Even on more kind of general level, the different cultural differences, where in some cultures family and being together and community are more important values than individualism. And then some of my patients perhaps, really struggling with that conflict. Where do they place themselves? That they have a part of themselves that wants to prioritize their individualism, but at the same time, they don't want to give up on the great community that we sometimes can lack in Western culture. So a lot of kind of interpersonally rich, intercultural rich work that I would see.
If you would share one tool, belief, or approach that is a must-have for you as a therapist, what would that be?
I think I'm going to be terribly boring because I wanted to talk about ethics. So it's something which I'm absolutely passionate about, and I think it's incredibly important. And I think for me, it transpires on so many levels as psychologist and psychotherapist, because it's such an intimate profession. And, we're getting such an unique access to people's life and very unusual setting. And people can be so trusting towards us. So I think it's on all levels for me. It's about being ethical when I assess the patient. If I'm thinking I'm not the best person for them and they're struggling to really take to me or to this work and I'm not able to overcome it. Because one thing is that obviously we train to work with those things and make use of them and understand them. But sometimes we might not be the best person for this patient for all sorts of reasons. Or this approach might not be the best one, and really think about that and take that into consideration and advise someone well when we consulting, rather than just take on the patients as they come. Really think about them, what they bring and what they need, what is our relationship, and advise them what would be the best approach. And I think that should continue during therapy. Sometimes we might think something is the right approach for someone, and there's so much struggle along the way, and again, we might try to work on it, but sometimes it's not possible. Then we should really take a stock of things and think what's best for this person at this point and put it as priority. I think another aspect of this is safeguarding for me, which is a very UK way of working. We have such a privileged access to people's life and people's stories. And if I'm hearing about a vulnerable child or vulnerable adult who's not even linked directly to my patient, it's still my responsibility to think about that, whether I should be doing something or whether I'm turning a blind eye and I don't want to know about it. So I think there's kind of a value of really thinking, well, we can bring social change as psychologists and psychotherapists, and we shouldn't be turning a blind eye. And if we're hearing about something that we should inquire about or be curious about it. Sometimes it requires us to step a little bit out of psychotherapy position, but really advise what should be done, or thinking whether we should be reporting something because we need to take care of someone. So I think it's thinking about it on a much more systemic basis for me. And finally, I think it's coming back to your point that it's about thinking, well, it's a profession where we really need to put patients' interest first. So it's not about them loving them or liking us. We're not friends. It's a great responsibility to try to help someone. And that means that sometimes, we might say cautiously things that might not be liked by the patients, which obviously in psychotherapy training one works on. But I think it's really important, coming back to boundaries, to be quite boundaried. Because I have seen definitely the things at the other end and patients coming back to me with experience with psychotherapists who wasn't very bounded. And I'm not talking here even about abuse cases, but cases where the boundaries are fluid and perhaps it's too much of friendship going on in the relationship. I have seen detriment of it. So I think it's something about absolute value for me.